Hi, my name is Dr. Marwan Sheikh. I'm a reproductive endocrinologist in Jacksonville, Florida. Today I will be talking about Invocell and how it is different from in vitro fertilization. As you know, with in vitro fertilization, the egg is removed from the female patient. It is taken to the lab where it is fertilized and grown in culture for 3 up to 5 or 6 days and then put back in the uterus. Because of that fact, you have to use lab equipment, lab personnel, and that incurs a lot of expense for the patient. Invocell, as seen by this picture here, is this little gadget where the sperm and the egg are put, and that case is inserted in the vagina and kept in the vagina for 5 days. As shown in this picture, the sperm and the egg are placed in this little cone shaped gadget. As shown here also, you can see how the little cone is placed in the carrier with the cap on it, and it comes with a little diaphragm that is inserted in the vagina to keep the Invocell in. As shown in this diaphragm, this is the uterus, ovaries, and tubes, and this is the vagina, and this is how the Invocell is inserted and stays in the vagina with the diaphragm to keep it in place. It is claimed that the cost of Invocell is 1/2 the cost of in vitro fertilization. What is the real fact? The real fact is in vitro fertilization in our program is $7,950 and Invocell is $6,000. So it is certainly not half the cost. In addition to that, in some of our patients, we give a discount based on their annual income. And sometimes the cost will be almost as much for IVF as it is for Invocell. It is suggested that the Invocell pregnancy rate is comparable to that of in vitro fertilization, and that it ranges between 29% up to 53% in one study. However, it is very safe to say that there is very limited literature on the success rate of Invocell. Compare that to in vitro fertilization, where the pregnancy rates are very well established over many, many years. They do differ between programs, but they can be as high as 70% per cycle start, especially in certain category of patients. Few comparisons between Invocell and IVF. With Invocell, it is suggested that patients are less than 38 years old, while with in vitro fertilization, you can use it in older patients. The BMI, which is a reflection of the height and weight of the patient, should be less than 35 with Invocell, and it can be more than 35 with IVF. With Invocell, you definitely cannot have a sperm factor because if you add the sperm to the eggs, it may not fertilize. While with in vitro fertilization, if the sperm is of poor quality, you can use the process called ICSI, intracytoplasmic sperm injection, where you inject a sperm into an egg and make sure it fertilizes. In all fairness, there are some programs now that are using this process even with the Invocell procedure. It is worth mentioning that Invocell is limited by the number of eggs you can use, up to 7 eggs, which is not the case with in vitro fertilization. It is also limited with the days of culture, as you can culture the eggs up to 3 days or 72 hours, which is not the case with in vitro fertilization. Of course, some physicians use it as a day 5 culture, but this is an off-label use. Dr. Doody, who had an experience with Invocell, says that blastocyst formation or day 5 embryo transfer with Invocell is inferior to in vitro fertilization. In one study, Invocell resulted in 31% good quality embryos as compared to IVF, which resulted in 51% good quality embryos. And finally, as suggested by Drs. Babayev and Jain, Invocell promises to be a viable treatment alternative. Questions, however, regarding its cost effectiveness and outcomes in various patient populations have still to be answered. Thank you.